Hello, everyone, and welcome. We'll get started in just a moment. We're giving people a minute to get connected to their audio, but thank you for joining us. Hello, everyone, and welcome to our ISPCAN Prevention webinar series. ISPCAN International webinars are always free of charge and cover diverse topics and programs, which are presented by subject matter experts from around the globe. These 90-minute sessions are designed to help you, our members and partners in the ISPCAN community, gain access to knowledge and expertise to inform care, improve practice, and drive policy change. All this is critical to help improve the outcomes for children globally. We are especially excited about the month of November because it marks our ISPCAN annual Child Abuse Prevention campaign. This campaign is 19 days of highlighting the great prevention programs of our ISPCAN country and international partners, as well as our ISPCAN members and colleagues. It's 19 days of providing cutting-edge open access prevention resources on our website and throughout social media. And we want you to join us in these last few days of the campaign. Please use the hashtag #RiseUp2EndChildAbuse to help share a resource with us or a program. Help us work together as a global community to share multidisciplinary tools, programs, resources, and best practices. All of these efforts accumulate to the World Day for the Prevention of Child Abuse on November 19th. As part of this special month, we've hosted 3 webinars this month. On November 1st, Breaking Barriers with Song, the global impact of Chrissy Sykes' My Body is My Body music program. On November 8th, with our partners at ELISA, the value of multidisciplinary approaches to child abuse prevention, best practices, and sustainable applications from Greece. The recordings of both of these webinars are located in our Knowledge Hub on the ISPCAN website under Webinars. And of course, we're very excited about today's session from our wonderful partners at the Smile of the Child and Missing Children Europe, Understanding and Responding to Children Who Run Away from Home and Institutions, highlighting the cutting-edge RADAR program. The tips for making the most of today's session. Please engage with us. This session is meant to be an active, interactive learning platform. Please participate by sharing your comments in the chat and your questions in the Q&A box throughout the webinar. We'll begin the open Q&A session immediately at the conclusion of the presentations, and having your questions already in the Q&A box really expedites that process. Also, please take a moment to introduce yourself to other attendees and our featured presenters in the chat box. Please let us know where you're joining us from, your organization, and your discipline. Excuse me. And to enhance your experience today, you can enable closed captioning from your Zoom control bar by choosing Captions. And as always, for joining us for today, a recording of this session, the panel discussion, presentation slides, and links to all featured resources will be sent to you directly after the webinar. Our key learning objectives for today's session: to increase awareness on the experiences and needs of runaway children among policymakers, child protection institutions, and communities; to improve the understanding of why children run away among law enforcement and professionals, and to improve both prevention and response for runaway children; and to advance effective recommendations for policy on the protection of children who run away or who are at risk of running away, and build responses and intervention strategies for runaways. And all our presenters today are from the Smile of the Child and Missing Children Europe. Right now, I'd like to introduce Pihi Protosaltas, Coordinator of International Cooperation at the Smile of the Child. Pihi joined the Smile of the Child in 2015, and she's responsible for all international partnerships of the organization, multilateral, including international organizations and networks, and bilateral with key national organizations. She has over 25 years of experience as senior management in international nonprofit organizations, which has included, among others, the identification, negotiation, security, and implementation of numerous international and domestic partnerships and projects in several key areas, including human rights, administration, public affairs, project and financial management, human resource, outreach, conflict resolution, and operations. Since 2015, Pihi has been on the board of directors of Missing Children Europe. She also serves as coordinator of the European Anti-Bullying Network, whose presidency and secretariat are held at the Smile of the Child. In 2021, she was elected Deputy Regional Representative for Europe for Child Helpline International. And with great honor, Pihi will present and introduce the president of the Smile of the Child.
Thank you very much, Jane. Kalispera to everyone. Good afternoon to everyone. I've been following the chat and seeing that we have representation from all corners of this world. So I would like to hereby present the president of the Smile of the Child, Mr. Konstantinas or Kostas Yiannopoulos. Kostas Yiannopoulos was born in Athens, Greece in 1952. He obtained his degree in marketing from Birkbeck University of London. And upon his return to Greece, he developed 2 companies in the fields of informatics and office mechanical equipment. However, in 1995, when his younger son, Andreas, aged 10, was diagnosed with cancer, he left his business to help his son fight this battle for his life and make his wish come true. Sensitive and caring, Andreas dreamed of an organization whose mission would be to support all children in Greece and all over the world who may be in danger or have any need. This little boy believed that every child deserved a smile, and this is the reason why he named this organization, in his own words, in his own diary, the Smile of the Child. Thanks to the offers, donations, and support of Greece's business world, people, and society as a whole, the Smile of the Child has now completed 28 years of continuous presence in Greece and has become a point of reference for every child, parent, public worker, government agency, as it has succeeded in implementing a wide spectrum of efficient, direct, and flexible initiatives in order to provide services to and protect children and families at risk in the critical areas of violence, health, missing, and poverty. Actually, just yesterday, we had a big anniversary event to celebrate our 28 years. Kostas Yiannopoulos is the president of the board, also the board of directors of the European Anti-Bullying Network, and continuously since 2012 when it was created, while he has also served as member of the board of the International Center for Missing and Exploited Children, ICMEC, for several years. In 2014, he was awarded the European Citizens Prize by the European Parliament for the outstanding contribution of the Smile of the Child to the protection of children's rights. And very recently, in 2021, he was awarded an honorary doctorate at the Department of Education and Social Work of the University of Patras here in Greece by the same department in honor of his 27 years of uninterrupted and substantial contribution to any child in need or at risk. So I can say as a staff person of the Smile of the Child that Mr. Yiannopoulos is not only the president of the organization, but the one who inspires staff and the one who works on the front line 24/7 to protect and support any child in danger or in need in Greece. So having said that, I would like to give the floor to Mr. Yiannopoulos.
Introduction, P. You see, we're here to support the children and to protect the children in their everyday life. I would like to welcome you all to this webinar co-organized by the International Society of the Prevention of Child Abuse and Neglect and the Smile of the Child. The Smile of the Child has been participating as country partner in ISPCAN since 2018, and we are particularly happy and proud on this. As though through the partner cooperation, we exchange know-how and experience valuable for expanding and upgrading our services, which kind of numerous services actually. Today's webinar is the 3rd webinar in a row that we are co-hosting on the extremely critical issue of understanding and effectively managing incidents of children and adolescents running away from home or child protection settings, a topic that it is of international concern to actors in the field and that the Smile of the Child and the European Federation Missing Children Europe has been working in depth trying to understand the causes and to design and implement services and actions, first of all for preventing, but also for dealing with the incidents. A key pillar was the European RADA program, through which it was shown that running away is not a behavior problem, but the result of adverse experiences that an adolescent has had in childhood, such as physical, psychological, sexual abuse, parental divorce, the death of the close relative, and unfortunately many more to come. Thank you for joining us today, and thank you to ISPCAN for giving us the floor to showcase our work and findings. Thank you for giving me the floor. And I'm sorry I had to little bit change the program, but we have some incidents that I have to travel north of Greece and to continue our work over there. Thank you.
Thank you very much to Mr. Yiannopoulos for this address, the short address and welcome. So I would now like to present the panelists, the speakers for today. So we have three ladies, three speakers. The first one is Eugenia Yumi Miyashita, who is Senior Programs Officer and Safeguarding Lead at Missing Children Europe. She holds a bachelor's degree in criminology and applied psychology and a master's in children, youth, and international development. Before joining Missing Children Europe, Eugenia worked in London as a practitioner with missing and exploited children, as well as with adults experiencing sexual and domestic abuse. In 2013 and 2014, she volunteered as a field worker in Burundi, setting up a youth center for street children and supporting staff in hospitals. Our second speaker is Stavroula Spiropoulou, a colleague of mine at the Smile of the Child. Stavroula Spiropoulou is a psychologist and supervisor of the hotlines and helplines of the Smile of the Child. Her experience in the organization started 5 years ago in the homes for children victims of any form of violence and neglect. And since then, she has been working with missing and exploited children, children victims of violence and neglect, as well as missing adults. Her academic interests revolve around child and adolescent mental health, psychopathology, and psychiatry. She has also volunteered in centers for children with autism and unaccompanied minors. Our third speaker is another colleague of mine, Ioana Gika. She's a psychologist and clinical neuropsychologist working for the Prevention and Awareness Department of the Smile of the Child. Her experience at the organization started 5 years ago in the daycare homes for children and families dealing with any kind of violence and neglect. She has also work experience with drug abusers, refugees, and demented people. Her interests involve working in prevention, addressing children, teachers, and parents, and the crisis management field, while she also participates in European projects aiming at child protection in a holistic way.
Thank you, Pihi, and my apologies, I was muted. I wanted to offer sincere thank you to Mr. Yiannopoulos for joining us and for addressing our participants today. So thank you to him, and I hope he has safe travels. We wanted to start this session with a poll. So this is a Zoom poll, so please feel free to answer from your desktop. So although we know that there may be multiple contributing factors, we wanted to know what you thought is the primary reason that children run away. So please select your answers. We'll give him just a moment to come in. So Thank you. We have some active participation, so thank you so much. We'll give it just a few more moments. Very diverse answers, and we'll share the poll results with the audience. And let me share the results. So interesting. The presence of physical and emotional violence, definitely believed to be the primary factor. Eugenia and Stravola, any comments? Joanna, on the poll, were you surprised by the results?
Hi, everyone. Hi. Thank you for being here today. Well, this is actually what the findings from our research showed, that the presence of physical and emotional violence is the primary reason why children run away from home or from care. So, you know, it's very nice to see that there is this awareness also in the people that are here today.
Perfect, thank you. And I will stop sharing and turn it over to you.
Thank you. Thank you, Jane. And thank you, Pihi, for the introduction. It's really great to see, as Pihi said, so many people from around the world here and so many people showing interest in Radar and on this topic and on the needs and challenges of children who run away. I'm going to start by sharing my screen. Can you let me know if you can see it?
Yeah, we have a gray box. You might need to disable the captioning for video.
Has it gone?
No, it's still there. There you go. Perfect. Thank you so much.
Okay, great. So I'm going to present the research that we did for the Radar project and the methodology. But before I do that, I'm going to briefly touch upon what Missing Children Europe does and also give you a little bit of background about the Radar project itself. So Missing Children Europe is the European Federation for Missing and Sexually Exploited Children. Our aim is to protect and empower children, to prevent them from going missing and to keep them from harm when they do go missing. We achieve this through activities and projects that focus on research, training, advocacy, and awareness raising. We have a member network of 27 organizations across Europe. Our members share the same goals and principles as us, and their work extends from sharing publicity appeals, linking up parents with law enforcement investigations, enabling support across borders, raising awareness, and offering both prevention and support interventions, just to name a few of the things that they do. The groups of children that we work with at Missing Children Europe are, of course, children who go missing after they run away, missing children in migration, parental abductions, abductions by third parties, and lost, injured, or otherwise missing. We also coordinate the network of 116 missing children hotlines, facilitating exchanges and cross-border cooperations. The hotlines are run in 32 countries across Europe, and 27 of these are our members. They provide free and 24/7 services to children at risk of going missing and to their families. They offer a range of different support, from emotional to psychological to social to legal to administrative. And in most member states, children and their families can access these hotlines not only through phone, but also through different text-based communication platforms such as chat services. We annually collect data from our hotlines to identify emerging trends and emerging issues in the context of missing children. So every year we produce a figures and trends report showing this data, which is available online on our website. And last year alone, the hotlines answered 2 million calls from children and from their parents and supported 70,000 cases of children who were going missing. So the Radar project focused solely on children who had gone missing after running away from their home or from their care institutions, or children who were at risk of going missing before running away. So it was a project that was co-funded by the European Commission, and it ran from March 2020 to October 2022. There were 6 European project partners as part of this project. So we had the Smile of the Child in Greece, who are here presenting with me today. We had YAC in Portugal, ISPCAN in Poland, Child Helpline International in the Netherlands, Child Focus in Belgium, and the University of Liège, also in Belgium. There was also a task force of professional experts. So these were professionals who were working in different fields, all related to missing children or specifically to children who were running away. And we had a youth board that was composed of young people from 4 European countries who had experience of running away or who had been at risk of running away at some point in their lives. So the aim of the project was to achieve progress in the understanding of running away and the experiences of children before and such an event. So there are still a lot of misconceptions around why children run away and what the underlying problem is. So this project aimed to advance that understanding and that knowledge. The objectives were to reframe running away as an indicator of adverse childhood experiences, increase awareness of the risk factors that can lead to running away, improve the capacity of professionals and law enforcement to respond effectively, and advance effective recommendations for policy. So the impact of the project in those 2.5 years, from 2020 to 2022, we launched a full research report and 3 key findings reports. These are all available online or on our website. We had 2 awareness-raising campaigns on the topic of running away across 6 European countries with over 500,000 impressions. We trained 28 organizations across Europe on youth-led research and advocacy. 342 professionals and law enforcement officials were trained in 4 European countries by our partners. And we launched 1 massive open online course, which is available on FutureLearn. It's free of charge, with currently over 800 enrollments so far worldwide. So the research that we did for Radar, there was a very strong need for the research because, as I mentioned earlier, there's still a lot of misconceptions around the issue of running away. The needs of children who run away are still very poorly understood. Little is known about the safeguarding measures for children who run away and the risks to which they are exposed to. Assistance for children who have run away and are living on the streets or are homeless is still a new area of research, and few studies address the issue of intersectionality and factors that promote the return to a regular way of life. So there is quite a big gap in the research in terms of the issue of running away, and consequently, this gap is reflected also in the practice when working with this group of children. So the methodology that we used for this research, the research lasted roughly 6 to 8 months. So it was almost a 1-year research, and it was across all of Europe. So together with Child Helpline International, we collected data from the hotlines and the helplines. In total, we collected data on running away from 34 hotlines and helplines across 25 European countries. Focus groups were ran with children and young people by our 4 partners. In total, 28 children were interviewed. There were 2 mixed gender focus groups, 2 same gender focus groups, 2 individual interviews with boys and 2 individual interviews with girls. We did an extensive EU mapping of professional experts and stakeholders who work in the field of child protection and or specifically in the context of running away. And then based on that EU mapping, we conducted a Delphi study with professional stakeholders that we identified to explore opportunities and best practices for children who run away. And in total, we interviewed and worked with 22 experts from 15 European countries. So this is a little bit of background on the Radar project and on the research that we did. I'm now going to give the floor to my colleagues at the Smile of the Child, who will present the findings of the research that we did.
Okay, so we would like to welcome you all as well to the webinar today. I'm more than happy to see that we have a lot of specialties in the audience, because we need this diversity in order to address the issue of understanding and responding to children who run away. And we're going to give you some data in the theoretical background with my colleague Ioanna Gika, who is a psychologist in the Smile of the Child in Greece. Just 1 second to move to the next slide. I would like to have 5 minutes to introduce you to our little founder, 10 years old Andreas Yiannopoulos. He was the son of our president, who you have met earlier. Andreas was a child that got severely ill, and right before he passed away, he gave us a little treasure, the goal and the aims of the organization, The Smile of the Child. So in the simplicity of the expression of the child, he simply wrote down in his diary a few words which concluded to the aim of the organization. The purpose was to have an organization that would give a smile to every child, support and prevention, no matter the ethnicity, the color, and the religion. And since then, we're following his orders. So, in the domain of missing children, in 28 years of being next to every child going missing, we have supported around 2,000 children, with the numbers being more for the first semester of 2023. So the Smile of the Child, since its establishment and to date, implements action with a goal to prevent as well to address every case of missing child, and operates the European line for missing children 116,000 in Greece. As Eugenia mentioned before, the project of Runaway aims to reverse the misperception of runaway as a behavioral problem, and the idea that children go voluntarily missing and are not at risk, because these consequences in negative assumptions, underreporting, and the lack of proper support from professionals. So the project aims to support professionals and raise awareness. So, which children are considered missing? There is no universal definition about a missing child, but in MCE we use the definition of missing child defined as any child under the age of 18 whose whereabouts are unknown to his or her legal guardians. Missing Children Europe defines the term children as anybody who is under 18 years of age. And there are some categories under the umbrella of missing children. All these categories are conceived as missing children as well. The first category is runaway children, minors who run away from home, from people responsible for their care, or from institution where they have been placed. Parental abduction cases include cases where a child is taken away from his or her parents or persons having the parental authority. Parental abduction from third party involves any abduction by other than the parents. And missing unaccompanied migrant minor disappearance includes migrant children under the age of 18 who have been separated from their parents. The category missing, injured or disappeared minor includes all the other cases that, in fact, we don't know what happened to the child that has gone missing. And now there is the question if there is a reason why we should address the problem of missing children and runaways. And in order to answer if this is actually important, we are going to share some data from missing children and some statistics. First of all, from the European Missing Child Hotline in Europe, you see that in 2022, MCE has handled around 7,000 missing children cases. The picture goes as well in Greece. So from the hotline, now you can see some facts and figures from the MCE annual report. 53% children were pushed away of home or care. 81% reported violence, and 2/3 were children who ran away again. And now the picture in Greece, 9,071 points of contact, out of which 60% were related to adolescent runaways. So the biggest percentage was in the category of runaway children, which concludes that the problem is actually there. Some indicators that have to be considered when addressing the issue of runaways, first of all, is age and gender. We see that the number of the age goes down and down. In the Radar project, the youngest child that has run away was under the age of 10. Girls are overreported than boys. Locations from where children run away gives us indicators for prevention targets, for example, homes or alternative care, and the duration of runaway episodes, because the longer the child stays away from home, the longer it is exposed to danger. Of course, repeated episodes of runaway question the current interventions to address root causes and alleviate the need of runaway children. We should keep in mind that no matter the categories that I have mentioned before, every child who leaves home is by definition a child in danger. There are misconceptions about the category of runaway children specifically, which are usually considered as children who are not at risk, who go voluntarily missing, who are seeking attention or have deviant behavior. And usually we forget that these children are in need of help. In the Delphi study that was a procedure in the project of Radar, there were participants from 15 European countries, professionals, and 95% of them were working with runaway children. And then we can see the stigmatization by professionals, which concludes to the loss of opportunity for these children to receive support, sets a barrier to accessing help, and the most important, the lack of trust between young people and the adults in their lives, which sets a barrier to accessing help. The dangers are a lot. First of all, the danger of getting involved in a physical harm, of getting injured, exploitation or trafficking, because children who run away are often very vulnerable to these situations. And of course, we should not forget the emotional and psychological impact that a missing child can have itself and also for his family. The most common risks of runaways include sleeping outdoors, homelessness, exploitation, and the risk of criminalization, because we forget of these children are possible victims of these crimes. And now to return to the first question, why do children and adolescents run away? I think we should have the children speak for themselves and have the results from the focus group addressed. And my colleague Iona Gika, who took part in these focus groups, are going to give a picture.
Okay, hello everyone. So that was the initial question. Why do children and adolescents run away? First of all, let's start with a little bit about the focus groups. They were conducted by 4 different project partners in 4 different countries: Belgium, Greece, Poland, and Portugal. What was the aim? Actually, the aim was to understand a little bit about the key drivers and also about the ACEs, what we call. ACEs stand for the adverse childhood experiences that kids have. And sometimes they lead them to the runaways. Sometimes it's also the result. Many times we don't know what came first. I mean, the runaway or the ACE. And then also, it's good to remember that there were 28 people in total participating in the Radar project, from 14 to 32 years old, and mainly girls, 20 girls and 8 boys. All of the participants had the experience of runaway, or they were at risk of a runaway. Before starting using the words of the kids, because it's really important to have them here and listen to them, it's good for us to know that there are kind of 3 different groups, categories of runaways. We're talking about children running away from something. We're talking also about children running away towards something else, and also for kids being pushed out from home or institutions. So this first case by a young girl from Greece says that it was my upteenth time I was taking on parental responsibilities, because since my parents were separated, they didn't always do their jobs as parents. They'd say, yeah, you can find a solution. And it was the same with my younger brother. I had to sort things out for myself. So in this case, we can understand that the child has already started distancing herself from the other people, just because this is a tough situation that is going through. And then there's also abuse and neglect in this context, which is really common in cases of runaways. The second phrase says that I eventually left to go and meet Anton, so it seems safe, even though it wasn't safe at all. But I said to myself, I'm leaving, I'm going to go to someone who reassures me, someone I like a lot. So it was like that. I don't know if you understand how I felt, but that's how it was. In this case, we can see that there's a desire to get closer to a person, which is a concept that many times it has a positive emotional impact on the child, but exactly this impact is leading them to a dangerous situation in her need to meet people outside of the family context. And here we have the kids being pushed out of home or institutions. In this case, we can say that the environment gets too unbearable for these kids, and that's why they try to escape in a sense. And this comes from a poor relationship they have between the youth and their parents or carers, let's say, when we're talking about homes or institutions. So let's have a look a little bit about the ACEs, because these are the ones that when a kid is exposed to these negative or traumatic life experiences, then has many more possibilities to run away. So we can see that among the factors, there's the parental mental illness, drug misuse, alcoholism, or living with a parent who has been in prison or youth offending institution. Also divorce, separations, family breakdowns, many times affect in this way, or being exposed to violence. And it's important to mention here that it's not one kind of violence. We can talk about kids being violent, dealing with sexual abuse, domestic violence, physical abuse, psychological, and any kind of violence, and also neglect. So what's the link? What's the link between the ACEs and the runaways? First of all, the most common ACEs identified are violence, abuse, and mental health, as we said before, while the top 3 contexts identified where ACEs are most likely to occur are in the family home, the schools, and the care home, which are the places that mainly a kid exists. And let's see the impact on mental health. Of course, we can see that a wide range of mental health issues. Also, we can see that the problem can keep going while the child has already come back home. So this is really important to have in mind, because even depressions and suicidal thoughts can exist after a runaway. Another thing is that maybe an already existing problem that the child has can get worse when the child comes back, and also carers, parents that already deal with mental health issues can make things worse for the child as well. And let's see a little bit about the children living in care institutions. In these cases, we can see that they are at risk, of course, but they're at the same risk as the kids from coming from family homes. So here the difference is that these kids are more vulnerable in general, and the thing is that just because they have changed many contexts or people trusted relationships, they find it even more difficult to get connected or to or to feel safe. And many times they're going to run away just to reconnect with the family. We've seen that. And often they're going to think that this is a safe place or the safe way to do it. Of course, they've gone through a lot. But I think that the most important thing here is to not to focus on the runaway as a problem, because the runaway is just the top of the iceberg, is what we see, is what happens. So if we really want to deal with runaways, also preventing them but dealing with them, we should definitely focus on factors that they create the runaway. Safety, trust, support are the key factors for the carers and the professionals to work on. And that's why, just because it's really important to have a little bit about the strategies, I'm going to give the floor to Eugenia for her to go on. Thank you.
Thank you. Thank you, Iona. Before I go on to talk about the recommendations that have come out of the research and some critical elements for change, I'm going to show two short animations. These are animations that we made together with two young girls who were part of the Radar project. Both of these two young girls have experience of running away from home. Their stories are slightly different, and so they go slightly different trajectories. And we made these animations for the short online course, which I am following in the chat that Jane has linked for anybody that is interested. So I'm going to share my screen. And
We're not seeing the video quite yet. Is it loading?
sorry?
The video is, we're not seeing it yet. Is it loading?
Oh, no, it should be playing. Is what
Are
do
you
you
sharing
see?
screen? I don't think you hit share screen, maybe. There you go.
Sorry, apologies for that.
No worries.
Can you see it now? The white screen?
Yes.
And I'm just going to play a couple of seconds just to be sure that you can hear it.
Hello, my name is Julie.
Yes,
Could you hear
perfect.
this?
Thank you.
Okay,
Yes.
great.
I'm 24 years old. I was born in Belgium, but I've been living happily in Finland now. A few years ago, when I was in my late teens, I decided to run away from home, school, from my hobbies, just in general, getting away from everything. When asked why I ran away, the simplest answer is, it seemed like my only way out, the only option I had left. At the time, I was in a bad place mentally. I was really lost. I've always been a sensitive character. Everything seems to be 1,000 times worse. I'd broken up with my boyfriend and pushed away many friends. I was doing very bad in school or not showing up at all. I had created a bit of a drinking problem and was getting into arguments with people. I felt extremely alone in the world. At home, everyone just seemed disappointed in me. I was angry and sad all the time and didn't know what to do with my life. One morning after an evening where I got into a dispute with my parents, I decided it was enough. I packed a bag, took a tent, sleeping bag and my bike and left. On day 8, I was struggling with finding the way and finding food. I turned on my phone and read texts from family and friends. This must have been one of the hardest moments of my life. I responded from a text from Child Focus. The first thing she told me was that she was glad that I'd reached out. I was ready to go home. Child Focus called my parents, who called me back in less than 2 minutes. At the time, I didn't realize the risks of sleeping outside for 8 days. But I guess the biggest risk, especially for a girl, is a lot of strangers might show an unhealthy interest in what you're doing. Lucky I was aware of that, and I was always able to just make them leave me alone. Coming home, I got some positive and negative responses. A negative response was from friends who made me feel as I had let them down. I later found out that some police officers didn't take my case seriously because of my age, and no police came to see me after when I returned. The best response was from my dad when he asked me if I was ready to come home or did I need some more time. My dad listened and gave me the opportunity to say what I wanted. This had a positive impact because I was able to make changes that I'm happy with. For example, changing schools. I was showing signs of panic attacks and difficulties months before I decided to leave. I'm sure some people might have been able to spot the problem. I was already seeing a therapist, but she noticed I was very reserved. I'd ended up in the hospital 2 months before due to too much alcohol and a panic attack. Shouldn't someone there had asked me a few questions? School was also not very perceptive. I'd left the classroom several times during the course. No one asked me anything about that. Many people could have helped if they had just asked, paid attention, or listened.
Was that okay? You could hear and see everything before I share the next animation.
Yes, it was perfect.
Okay, great. So I'm just going to go on to the next animation, who is also another young girl. This one she's from Greece, and she also volunteered to tell her story and her experience. So I'm going to reshare my screen. Okay.
My name is Maria, and I ran away from home when I was 8 years old. The reason I left home was because I felt like a burden to my mother. My father was traveling a lot for his work, and she was alone with me and my little sister at home. Around the same time, she was also dealing with depression, which is something that I learned later on. I thought it would be better and easier for my mother to only have to take care of my little sister. My plan was to go to my godmother's house because she was living alone, and I thought that she could take care of me. On the afternoon I decided to leave. I remember specifically that I had chosen to wear my favorite dress and shoes, and I had packed a bag only containing a wallet with all my money and my favorite doll. After I left my house, I walked for a long distance. It was about 2.5 kilometers. Around halfway there, I encountered a risk while walking. Except for looking out for traffic lights, I didn't know what else I had to watch out for, and I ended up almost being run over by a passing car. After this happened, it was the first time that I felt as thought I regretted my decision to leave home, and I started to walk faster with tears in my eyes. I became tired, scared, and it was starting to get dark, so I decided to go to my grandmother's house instead. I remember that when she opened the door, she was already crying because she had been informed that I had left home. She hugged me and I started crying too. I don't have any memory of the days after my runaway episode. I only remember the moment that my father found me and nothing else. Since then, I haven't talked with my parents about what happened in the days that followed. I guess that if I had known the existence of any child hotline or social service that could have helped me, I probably would have called to tell them my problem. I think it's critical to inform children in schools and on public transport about child hotlines and social services that are always there to help, that they are anonymous, and that they address any problem any child is dealing with. Now that I'm thinking about my story again, the person that could have helped me most if I had spoken to her was my teacher. I could have also gotten help from a child hotline or another support service, but I didn't know the existence of them. I think building relationships between children and professionals, such as teachers, social services, and police, is very important because children will understand that they can talk about their problems with professionals. This would help reduce the number of runaway episodes because children would be more informed about other choices and would be able to find better solutions than to run away from home or the place that they are living in. I think we can build this trusted relationship starting by informing and educating teachers and police. After that, we can do campaigns to inform people about runaways, what the reasons are for running away, and in this way make the topic less taboo so that people with experience of running away feel less judged.
Okay, so those were two stories. Thank you, everyone, for listening to that. I know sometimes there's stories that are not that easy to hear or to listen to. These are two different trajectories that these two young women took. Actually, this last one, she ran away when she was very young, 5 years old. So running away, and I saw this was one of the questions in the chat, running away is a problem that spans from very early on up until the teenage years. It can cover most of the childhood years. So I'm going to reshare my screen again, and I'm going to present the recommendations that we developed from the research, from the radar research. So here we go again. And okay. So there were a lot of recommendations that came out, and they are all available online in our full research report. Today, I have divided the recommendations in two parts. So policy recommendations for national governments, and these are the first ones I'm going to talk through, and then policy recommendations for local authorities and public bodies. So the first one really is really about recognizing the link between adverse childhood experiences and running away. So as my colleagues at Smile of the Child said, violence and abuse are one of the more frequent reasons why children run away. And so really recognizing running away as a symptom of one or more ACEs is crucial. And what's even more important is reflecting this in relevant legislations and policies. The second, with the support of local authorities to develop statutory national guidance and protocols on children who run away from home or from care. What we saw in our research during the mapping was that very few member states have such a document. The only one we were able to find was one in the UK. The UK have a specific guidance on what professionals should do when children run away from home or from care. And it's a statutory document. And it covers everything from clear roles and responsibilities for different actors when they respond to a runaway case, follow up with children and their families, and existing protocols on referrals and case management systems for information sharing and services. Third, introducing return home interviews by an independent person as a recommended practice after a child has run away. Again, we noticed that few member states implement this. The UK, once again, was one of the few who have this as a mandatory practice. So when a child returns after running away, they send an independent person to do a return home interview. Now, what we saw was that a lot of countries do interviews with children once they come home, but frequently this is done by a police officer or a social worker. And what we have seen is that frequently children don't feel as comfortable to talk to a police officer or a social worker. We know that that power dynamic, that authority figure can be a limitation. And so really, we recommend return home interviews to be done with children by an independent person. Fourth, invest and facilitate the capacity of child hotlines and helplines to offer online psychological support to runaway children and to their families. So we saw in the research that child hotlines and helplines were assessed as positive by young people. However, their services and their potential role in the lives of runaway children were not always clear. So really, it's very important to develop protocols for responding to runaway calls in cooperation with other actors, and expanding resources for child hotlines and helplines to help them improve the dissemination of valuable information for children, and increase efforts to connect children with these services, with the services of hotlines and with the services of helplines. Lastly, improving reception conditions for children in migration at risk of running away. So the findings, as we've covered, showed that one of the reasons why children in migration go missing, some of the reasons why children go missing from reception conditions, are lengthy procedures, inadequate conditions in the centers, and to be reunited with their family and with their friends. So prevention is very challenging for runaway children in migration, as it is in many cases, but it should be targeted at investments for adequate reception conditions, thorough risk assessments at arrival, and performant, high-quality, effective guardianship systems. Now, the policy recommendations for the public bodies and for the local authorities are a bit more extensive. So the first one is introducing mandatory training for local authorities and public bodies on the trajectories of different groups of children who run away. And these proposed trajectories should also include gender dimensions and experiences. So as my colleagues at the Smile of the Child said, there are different trajectories that have been identified. So children who are running away from something, whether that's abuse or violence, and children running towards something. If they're being groomed, they might be running towards their groomer. So training needs to take into account these different trajectories. And for different groups of children, like girls, children living in care institutions, children in migration, these trajectories will look different. So it's very important that this is incorporated in training to local authorities and public bodies. And of course, training should also work on prejudice towards certain groups of children, and it's important to develop specific lists of resources and services for referral. Second, introducing mandatory training for local authorities and public bodies on ACEs and integrating this into basic child protection courses. So we've seen how important and how significant the link is between running away and ACEs is. And so the trainings should focus on the identification of ACEs, adequate responses, adequate reporting, and there should be a strong element of prevention in this case. So really training on how professionals can do an early identification of ACEs before things escalate. Third, introducing training on the importance of a positive return home or to care for the prevention of repeat incidents of running away and the exposure to further ACEs for children. So we know from the research that the moment that a child returns home, that specific moment is crucial in their decision to run away again or not. If they are welcomed home in a positive way, in a way that says, we understand, we want to listen to you, and if they see that a change has happened in the situation that they've run away from, this will massively impact their decision to stay or to run away again. So that moment of return is crucial and needs to be prepared with parents, with carers, with professionals involved in the children's lives. And then, of course, fourth, enhancing the effectiveness of training to professionals with the use of real-life case studies. We've seen that this is much more efficient than just having theoretical and just list of information put out in training, but really having real-life case studies similar to the animations that we've just showed you before my presentation. Fifth, standardizing the inclusion of counselors and staff within mental health training in schools from early on. So, many of the children in our research stated that even after they returned, they continued experiencing mental health issues for a very long time, such as suicidal thoughts and depression. So really, we're advocating for local authority figures and public bodies to receive training on how to work with children, on how to listen and how to communicate with them, and to have training on mental health issues, and to have these professionals, counselors, psychologists, staff that's trained on this issue readily available in schools from very early on in the early years. Six, with support from public bodies, advocating for leisure activities and clubs to be widely and freely accessible to all children and young people, and for these to encourage a sense of inclusion, belonging, and social cohesion. So this theme of social ties was not really part of the research. It just kind of came out in our discourse with children. And the social link identified refers to the importance that runaway children attach to the feeling of being part of a social fabric, of being involved in activities and with people who matter to them and for whom they matter for. So it's really a means to tackle the loneliness that some of these children might feel. And so they were very much calling for this social cohesion and this bond. 7, improving the dissemination of valuable information for children and increasing efforts, such as funding and resources, to connect children with existing services. So proposed tools to achieve this are, of course, social media platforms, online platforms that are easily accessible to all young people, the creation of phone apps, and accessing strategic areas such as schools and train stations where children who run away might frequently visit. 8, with support from public bodies, building and strengthening bridges between children and young people and local authority figures, mainly police and social services. Proposed actions for this recommendation are involving local authority figures and leisure activities for children and young people, introducing in an informal manner local authority figures as part of regular school activities, and of course, improving the continuity between local authority figures and the children and the families that they work with. And I remember, as part of the Radar project, I remember speaking to a professional who was part of our Delphi study, and she explained that in her city, they had police officers go into schools for half a day and talk to the students, not necessarily host a workshop where they talk about what the police does, but really engage with students for half a day, get to know one another, build that trust so that if it ever came to it, children would feel more comfortable reaching out to police and to asking for help. So it's really about building that bridge, because we know that children and young people may fear or have some sort of concern about contacting police officers. There's that authority figure that, you know, hinders that relationship. So we really want to work on building those barriers. 9, encouraging and facilitating the relationship between children living in care and their families. So again, as my colleagues at the Smile of the Child said, some of the primary reason why children run away from care institutions is to be reunited with their family and with their friends. So we propose developing visitation schedules in partnership with children and young people. So really giving children that voice and that agency, facilitating regular and consistent contact between children in care and their families, and making mediation, where necessary, readily available for children in care and for their families. 10, advocating for increasing safety work within communities through the creation of safe spaces for children and young people, and funding for training of youth services and their staff. Additional proposed actions for this are increasing the provision of informal youth drop-in services, developing welcome centers for children who might be thinking of running away, and improving generic services with open access for children. And lastly, integrating communities such as public transport, late night staff, etc., into multi-agency responses and protocols. Something we heard too many times was children telling us that they had spent the night in a McDonald's, or that they had fallen asleep at the train station, or that they had spent the entire night on a bus, the night buses that go around and round, and that nobody, no bus driver, no staff at the restaurant, nobody ever approached them. It didn't raise any red flags, and if it did raise a red flags, nothing was done, no action was taken. So really, we are advocating for training on ACEs, on running away, on reporting to public transport staff and to other community members, such as late night restaurant staff, and including, as much as possible, wherever possible, communities in regular multi-agency conferences and meetings. So members of the communities need to be part of the multi-agency response. It cannot just be police and social services, because children and young people spend most of their time in the community. So they need to be part of that multi-agency response, and they need to be able to act on their concerns and to identify a child who might be at risk. And also, of course, developing awareness-raising campaigns that are targeted at communities. We see a lot of campaigns targeted at children and families and professionals, but really we need to also speak and target our awareness-raising campaigns to community members. We also identified as part of the research 3 critical elements for change. So the first one is introducing and increasing efforts to reduce stigma and existing negative perceptions about runaway children and on running away. As you've already heard during the presentation on our findings, there is a lot of stigma on children who run away. It's very much rotating around the idea that children who run away are attention-seeking. It's a behavioral problem. We spoke to some social workers who said that if they have a child who runs away multiple times, there is this stigma, there is this sense that, okay, the child has done this before, they'll come back, he's safe, he's not at risk, he's not going to change his behavior, and we really need to work on changing that stigma. So further significant areas also include mental health, being a victim of violence, families that are accessing help. These are all areas with stigmas attached to them, which hinder the child and the family's decision to ask for help. So proposed actions for this recommendation are, on the larger scale, developing awareness-raising campaigns targeting different audiences based on the messaging. On a more local level, developing ethical codes and policies with local authorities and organizations to decrease the stigmatizing behavior and improve reporting. And then, of course, training is a key element in many of these areas. So developing training on providing non-judgmental support to parents and families, and also training on acknowledging unconscious biases that one might have. The second critical element for change is the identification of a trusted adult in the lives of children and young people. This was a common and significantly important theme in the research findings. Young people seek a figure that is defined as their person, and to identify them as someone who's available to them when they are in need. In, I'm going to say most cases, this might be a parent, but we know that that's not necessarily true for many children. So the trusted adult can be anybody, can be a teacher, can be a social worker. The children identified key characteristics that makes an adult a trusted adult, and this included non-judgmental attitudes, stability, and openness. So really, it's about working on supporting children and identifying a trusted adult in their life. And lastly, maybe most importantly, establishing consistent and widespread inclusion of child participation among child protection institutions and policy work. So to achieve this, there needs to be a shift in attitudes toward children and young people's competencies and towards an understanding of them as meaningful partners and as partners who are able to voice their needs and to voice the support that they need, and to really listen to them. So proposed actions to improve the inclusion of children and young people within service designs and policy work are to meaningfully involve children in the development of interventions and services. So services that are available or that are being developed for children who run away should be developed based on the experiences of children. And this can only be done by talking and listening to children and young people. Involving children and young people in training to professionals, developing co-operator protocols between children, young people, and professionals, introducing young people as life experts and mentors in services for other children. This peer-to-peer work was a common theme in the research findings. Children asking to hear from other children who had been through similar experiences. And lastly, creating youth ambassador roles among different child protection institutions. So thank you all for listening. As I mentioned at the start, the research, both the research findings and the recommendations that came out were so extensive that we have very much touched upon the key ones. But if of interest, I would strongly urge you to go and take a look at the full research report that we have available online, just to see, to get a bigger picture of what's come out of the radar research and what we've been advocating for since then. So thank you all for listening. I'm going to stop sharing my screen now, and I will give the floor back to Jane.
Yes, thank you so much to all our presenters. At this point, I welcome everyone to turn their cameras back on, our presenters, and your mics for the Q&A session. We've got lots of great questions coming in. Some were in chat, so I want to make sure I don't miss those. So I'm just going to start with a couple that did come directly to me. There was a question about data collection for the project. What discipline or what organization was primary in reporting? Was it schools? Was it parents? Was it law enforcement? And then with that, the question asked that it was stated that more girls were reported missing. But was that a reporting issue? And do equal number of boys run away? They're just less reported. So those are kind of two data questions I put together, whoever would like to address that.
Maybe I can address the first one about who was involved, and then the second one can be addressed by Smile the Child. So, well, there were different areas of the research. So I assume the question is directed primarily at the Delphi study, because the quantitative data that we collected was specifically from the hotlines and the helplines. And then half of the qualitative research that we completed was with children and young people who have experience of running away, and the other half was with professionals. And in this case, I would say the majority of it was not teachers, it wasn't school. We had the majority of experts were working in social work. We had several professionals from law enforcement backgrounds, and we had practitioners from different fields, such as practitioners working with youth offending, practitioners working in mental health. So it was quite varied. I think actually teachers and professionals in schools or academic institutions was the least representative of all of them, and social workers was probably the most one. But again, this is all very much covered in the full research report. There's much more information that than what I can offer in terms of the participants and the data around the research.
Perfect. Thank you. Stravola, Ariana, do you want to talk about the reporting of girls versus boys?
Yeah, actually, the thing is that we should first make it explicit that the ages and the gender of the kids running away, they are varying. We can find many different ages, but the most common is a girl around 14 years old. So just because in the focus group we had to include kids that they had the experience or they had thought of running away, that's why the number of the girls it's way more than the one of the boys. We should not exclude any child or think that just any child by age or by gender will run away or not. We should not definitely do this. But what we observe is that girls have a little bit more of a representation on these on the runaways, and they also have a plan sometimes when they leave home. They are more well organized or prepared. That's why there are more the girls than the boys in the representation.
Also, maybe we should think about the fact that when it comes to externalizing behavior, such as running away, and not like internalizing behaviors like depression, anxiety, and all these things, girls usually get over-reported. Like it's more easy to detect a girl who has run away because maybe it is unusual for the family. Maybe the cases of boys don't get reported so much. But it seems that handling cases of girls is more usual, and the interpretation is really wide and needs to be considered from a general point of view.
Perfect. Thank you.
Sorry, Jane, can I follow up on what Stavroula just said, which is 100% what it was about? And there is a bit of stigma around reporting of boys, especially in certain contexts when you have boys who are being exploited, whether it's criminal exploitation or in particular sexual exploitation. There is that stigma about reporting a young boy who has been exploited. So there's definitely that element in terms of the gap, the diversity in the reporting between genders.
Interesting. We actually did a webinar on that not that long ago that just spoke to, the tremendous amount of boys who are trafficked and sexually exploited and that aren't recognized because we believe it is a gender-based issue for girls. And so agreed, it's a topic that's getting a lot of visibility now, and dutifully so.
Yeah.
There's a question about what in the recommendations or the protocols, I'm assuming is what he's asking. Are there immediate recommendations when you find children on the street? We have people, from a lot of parts of the world where children living on the street is a huge issue, and not necessarily runaways per se, but that through, poverty or, something happened to their families that they are actually living on the street. And do any of these recommendations or protocols, would they be helpful, and what immediate actions would be recommended from you based on your research?
So I think this is very, it's quite difficult in the sense that it's near impossible to have one recommendation for all member states. It's very different in each country, the protocols that one should follow. I know in certain countries, for example, Missing Children Europe is based in Brussels. I know that in Brussels, for example, there are specific organizations that you can call if you see a homeless child or a homeless adult. And this means that you avoid calling the police, because chances are that if you call the police, that child or that adult will run away, will attempt to run away. So I know that there are organizations here in Brussels that you can call if you see a homeless child or a child at risk. And this is so varied in each country. I don't know if Stavroula or Iona can speak about what the situation is like in Greece, but it's really very much about being familiar with the services on your territory in terms of who you can call and reach out to if you do see a child who looks homeless or at harm.
I totally agree, and thank you, Eugenia, for this. I would like to mention that the issue of homelessness for children is an issue that has been reviewed in the literature. Actually, a much variety of the literature that has to do with runaway children concentrates on the children that are homeless because they have run away from home and have nowhere else to go. So they have to find survival kits in order to find ways to find somewhere to sleep. And in these situations, it is very easy for them to get involved in situations in which they might be exploited, they might be trafficked, because they try to find places which they consider safe in order to survive, and they get involved in very difficult situations, which include the criminalization. They get involved in situations in which, in fact, they're the victims. So yes, the issue of homelessness and children on the street should really consider us and make us think about the protocols and the procedures in every nation.
Perfect. Thank you for that answer. And then there was a question about, the protocols and recommendations, and apologies if this was covered somehow. I think if you may have missed it, is there would be different protocols or recommendations based on whether a child is running away to escape abusive or dangerous situations versus children who are running away for other reasons. Can you explain that maybe in your research or in the recommendations or in the protocols, how those two situations would be handled differently and what's being recommended?
Should I how the two trajectories, so running towards something and running from something?
Exactly, yes.
So if you're, for example, it very much depends on the circumstances. So typically what we've seen is that children who are running towards something might be children who are being groomed or exploited for some purpose. And so in that context, we have a whole other issue at hand, which is exploitation that needs to be addressed. When you have a child who is running away from something such as domestic violence within the home, that requires a whole other kind of attention and support. So you're more or less, you're always going to have the same agencies interfering, I would say. You have law enforcement, you would have social services, but the kind of targeted and tailored support that you would be offering both the families, but also the child and the trauma that they've been to will inevitably vary based on the circumstances of that trauma. If that answers the question.
And I don't know if the question is more geared towards you would not want reunification of a child into an abusive situation, back into an abusive situation.
I mean, again, it very much depends if you have one parent as the perpetrator, or if there's, an abusive situation at home where both parents could be a risk of harm to the child. I would say that most of the time, support to families and keeping children within their family environment is what is a focus, let's say, is the primary goal. Separating children from the families is never the primary goal. So as far as possible, making sure that children can stay within their environment, can stay with at least a carer or a parent is what we try to work towards. But of course, there are situations where it's not in the best interest of the child. Yeah.
Jane, if I may just add that we totally agree with Eugenia, but and we should definitely also consider that each case is completely different. It's unique. We shouldn't try to put kids and their stories into categories, because in this way we're gonna just make stronger the reasons that kids run away. So we should definitely see that each story is a different story. Of course, try to prevent, but also deal with it. But I think it wouldn't help at all if we just created more categories that kids would try to fit in these categories, in a sense. So yeah, of course, there are some good practices. Of course, there's some guidelines and protocols, but we should always keep in mind that when a kid is out there, is in danger, and maybe the story that we think that it's her story, it's not the one that it really is. So we should be careful also with this part. Thank you.
That's perfect. I agree. Both of you really emphasize that point, that each child is different, each case is different, each scenario. You know, and I like how encompassing the recommendations are, because I do think there's a lot of adaptation there to meet all these varying situations. And there's a really interesting comment / question about, I'm assuming it meant like based on the recommendations and the protocols, which are very extensive. Could some kind of entirely new parenting education program come out of that? It says, should public health authorities be developing this kind of parenting education or caregiver education or institution education using some of these protocols, to really speak to the prevention of running away? I'm just kind of curious what your thoughts are on that.
I think, do you want to go, Starula? I think Smile the Child do a lot of work with parents. I think from my experience, parenting is very much is very much influenced by culture as well. So I think that's something that would have to be taken into account when you're if you're thinking of developing any kind of parenting education that's meant to reach a large targeted audience. And I think this is something that we felt a lot in the research as well. We had a lot of children and young people saying that the services in the country they were living from, if they were foreigners, weren't tailored to their cultures and to their beliefs. So, I think this is just something to keep in mind. But I will give the floor to Smile the Child in case they have something else, because I know they work a lot with parents and with families.
Yes, indeed. And we have to underline the pivotal role of the helplines in addressing these problems, because first of all, they are an exit to the child in order to speak about the problems that he or she are experiencing at homes. And we have prevention strategies that focus on the child before it runs away. Very simply, the child has the opportunity to call a helpline and get the help that the child needs before choosing to get involved in dangerous situations. And of course, it is very important to have adequate support after the child returns home. So the helplines have to take further actions to ensure the safety of the child and to make sure that the child has been asked about what were the reasons that led him to running away. If one of the reasons is violence, we should really try to make interventions to the family, usually giving an emphasis on the attachment between the parent and the child, and also the parental role and how it is expressed. between the relationship of the parent and the child.
I appreciate you bringing up the helplines, because I do wonder in low resourced areas, which some of our participants may be from, if you were going to have a starting point from the recommendations, and would it be the establishment of helplines, and how, and then if that were the case, then what disciplines then would you engage in the helpline? I mean, would it be social work, law enforcement, like who, if you were a starting point based on your research and based on the recommendations and protocols in areas that do not have any resources right now that really address migrant children or runaway children, would that be the starting point for you? And what recommendations maybe would you have coming from that?
Maybe first of all, to start to know the problem, to have the stakeholders together, to have expertise on the problem, and to have the opportunity to be accessible to every one of your population you want to support. So accessibility, the know-how, and maybe when it comes, for example, to runaway children and the violence, to have good reporting systems that will address the problem, and then can have a follow-up situation to have a cycle of what is going wrong and what is a good practice.
And also schools and teachers should be engaged in this process, because it's really important. Kids spend there many hours of their days, so maybe they could also get informed about runaways, get informed about how important it is to have trusted people, and talk about their thoughts, even when these thoughts are not considered to be happy thoughts, or the ones that we usually share and smile with other people around us. So it's really important for the kids to feel included also in schools, except families, and let's say also that it's, teachers and people within school are practically the ones right after the parents. So it's really important for them also to be educated and know how to deal when a child comes and talks about these negative thoughts, let's say, or that thoughts of running away. Because let's say that if I'm a kid and I'm trying to speak, and then the reaction is, you should not speak about this, or you shouldn't do that, or you're not allowed, then I'm not going to get any support. So what I'm going to do is that I'm going to improvise. I'm going to try to find a solution in different ways. So this makes me even more, puts me at risk. So I think it's that kids and teachers should be included in this direction towards preventing and also dealing with runaways.
Well, that leads us to our next question, which I think there's a huge interest. I love the way the videos brought in the voice of children in this problem and in this solution. There's also people want to know more about the youth ambassador roles. I think speaking to the point you just made about kids listen to kids, especially, when you see somebody who's been where you're at in regards to your desire to leave, or the tendency to run away. Or so, we'd love to know more about the youth ambassador roles, or how you engage, whether it's the videos or just in general in the recommendations and protocols. You definitely included the voice of children, which has to be incredibly beneficial.
Yeah, I mean, to be completely honest, all of the I would say 80% of the recommendations that have come out of this research were based on what children and young people shared with our partners during the focus groups and what we collected from the hotlines. So absolutely, I think it's of crucial importance. And children expressed the value of listening to other children who were in similar circumstances, more than listening to a professional telling them, you know, this is what your problem is. This is how we should go ahead and fix it. They were, you know, they wanted to hear children and young people who had been through the same stories, the same experiences, how they had coped with it, what had helped them. And I think the what was behind the youth ambassador recommendations was came from the other recommendation about building bridges between young people and public authorities, because what was thought about youth ambassadors was having, for example, 2 or 3 children and young people forming a panel in, for example, the police missing department team, or a panel in a sector of the children's services, and having those 2 or 3 people represent the voices of children and of other children and young people in their who had been through similar experiences. So having ambassadors, you know, working in that multi-agency framework with other professionals who could really bring the voice of other children and bring the experiences of our children to the table, instead of as things are run now, where you have a social worker having a one-to-one with a child, and then they are the voice of that child in multi-agency panel meetings.
Fabulous. Srila, Ariana, do you want any comments on engaging youth in this process as well?
Well, child participation, it's always what we're trying to do, because many adults from different roles, we think that we know, or we think that we have solutions, but things are completely different when kids have the power to speak up their minds and share, and also even create tools. So here we also do that. We have the youth team at the Smile of the Child, what is practically a group of kids that they decide upon different things and issues that they want to approach or explore a little bit more. And I think that in every case, and also in Runaways, we should definitely consider what teenagers especially say about it.
And also, when someone tries to build a service for children, it is very important to not forget to get back to them for feedback if the solutions that are given are the ones that made the change for them. Because we take decisions without considering if the child also thinks that this solution was the right for them. So it is very important to hear the children in decision making as well.
Absolutely. That's a wonderful stopping point. I know we're at time. I did want to ask really both organizations. I'm sure our audience is interested in what is available to them. Like Georgina, I know that you have the full report on your website. The recommendations and the protocols, I'm assuming, are on there. The free course, I know we're sending links to. What else would be available on both of your sites that could be of great benefit to our audience members?
So we have, so there's a full research report. There are also 3 key findings reports. Just because I'm aware that the full research report is very full. So we developed 3 key findings, which are each 6 pages long, which might be worth a bit, to get a quicker look at what the key findings, and they also include the key recommendations from each study. And then other than the ones you've mentioned, Jane, we also have on our website the annual figures and trends that we do every year with our hotline. So what I mentioned at the start, where we collect data from our hotlines on an annual basis, and we present data on all the different groups of children that we work with, including children who run away from home. And so on our website at the moment, we have the 2022 figures and trends report that's available.
Perfect. And I will link all of these reports on the webinar recap page. So all the items that you just mentioned, I'll make sure that we are linked, and then a link to the actual site.
Okay, thank you.
From our team at the Smile of the Child, is there anything that you would like people to be particularly interested in when they go to your website to find around this topic?
Actually, yeah, just having a look on our website, parents and carers and teachers, they can find a lot of many articles and topics related to different things related to children, of course, and taking care of them. And also we have the prevention and awareness department at the Smile of the Child. It's a department that psychologists all over Greece travel to meet kids, parents and teachers, and practically interact and educate them on different topics such as bullying, internet safety, abuse and neglect, and trafficking, and also about missing children and how to prevent runaways. So of course they can come in contact with us so that we arrange, let's say, a meeting with either parents or students or teachers, and they can also find a lot of they can find many videos, articles, and related stuff about all these topics on our website.
Perfect. Thank you so much. I know that we are at time, so if people need to leave, we totally understand. I have a couple slides I just wanted to share with you about some upcoming events and just a reminder about the session, and then obviously a huge thank you to our presenters. So first of all, again, I just want to offer the most sincere thank you to Missing Children Europe, to the Smile of the Child, the sharing of your great research, your incredible recommendations, your knowledge, your expertise has just been invaluable and really is, a great representation of what we're trying to achieve during this prevention campaign. So again, thank you for your time, and thank you definitely for your expertise. A reminder to the audience, just what they'll receive today, the presentation slides, all the shared resources that we've talked about, links to documents and websites, and the actual recommendations. The full recording from today's webinar will also be located in our Knowledge Hub. We'll send you the link to that in a follow-up email. And as always, an ISPCAN certificate of attendance from today. And just a couple upcoming events I just want to bring to everyone's attention. We are excited to announce our next International Congress in Uppsala, Sweden. Abstracts are open on our website. So if you go in under Congresses on the ISPCAN website, we just opened abstracts this week. So we're very excited about this. The Congress theme is working together in times of crisis. Emphasizing the difficult realities and new challenges that children face and the innovative solutions in our community and employing research and practice. So we hope you'll will be able to submit abstracts and join us at that Congress. And then we're also really excited to announce, many of you are aware we have our journal, the International Journal of Child Abuse. We are launching now our open access journal that really is bringing data and action into a practice-based journal. If anyone is interested in submitting articles for this open access journal that's practice-based, it is free of charge to authors until June. So we encourage you to go on our website as well and take a look at submitting articles for that as well. And then obviously we've got lots of new and exciting things happening at ISPCAN. So I won't go through these. I would just encourage you to go on our website and really take a look at what we have to offer. Our goal is to make sure that we provide it as many resources, whether our own resources or those of our partners, to help you in the work that you do and to certainly try to impact the outcome for children globally. So again, a major thank you to all of our presenters from both organizations. We sincerely appreciate your time, and to everyone who joined us today, thank you very much. And we hope you have a good day or night wherever you are. So warmest regards, everyone. Bye, everyone.